The topic that I chose to look at this week was oral contraceptives impair complex emotion recognition in healthy women. Although about 100 million women worldwide use oral contraceptives, there is not much known about its effects on emotion, cognition, or behavior. While it is known that the pill can cause a slight increase in risk of breast cancer and cervical cancer, and also blood clots and higher blood pressure, the psychological effects that the pill may have on women have been less examined. Coincidental findings from past research have shown that oral contraceptives, or OCs, may have a negative impact on a woman's ability to decipher between or recognize others' facial expressions. The scientists that carried out the experiment say that a better understanding of how the pill interferes with a woman's ability to recognize others' emotional expressions is important for maintaining personal and intimate relationships. Specifically, the goal of the study was to look at the effects of oral contraceptives on complex emotion recognition and whether or not there was a difference in ability between the women who were using OCs and women who were not. In the study, they looked at 42 women who were using them and 53 women who were not. In order to be included in the study, the women had to be between 18 and 35 years old, be native speakers, and be able to share information about their cycle and their use of OCs. In addition, they were not able to use any other hormonal contraceptives other than the oral ones that were included in the study, and also women who were in psychotherapeutic or psychopharmacological treatment were excluded. The task used to analyze the difference in abilities was the RMET, or Reading the Mind in the Eyes test. This test takes pictures of the eye regions of people expressing different emotions and asks the participants to choose between 4 options of emotions. Researchers say that this test is sensitive enough to detect even the most subtle differences. 2 analyses were then performed to look at the valence of expressions and the difficulty of expressions. In accordance with a previous study done, the results showed that the OC users were less accurate in their recognition of complex expressions by almost 10%. While both groups were able to recognize the easier expressions, as the difficulty increased, the success of the OC users decreased. Across all participants, recognition accuracy was lower for negative than positive or neutral expressions, and this was true for the valence of the expression. For future studies, it would be important to closely monitor hormones such as estrogen and progesterone, as they may also have an impact, especially because it has already been shown that estrogen and progesterone levels modulate activity and connectivity changes in prefrontal and temporal brain regions, which are involved in the processing of emotional expressions. Specifically, the prefrontal cortex and the amygdala will be important because the recognition of complex emotional expressions depends on activity in these regions. Furthermore, changes in estrogen and progesterone levels caused by oral contraceptives are related to changes in activity in the amygdala. Therefore, the researchers believe that the changes in the amygdala activity and amygdala prefrontal connectivity could have accounted for differences in the emotion expression recognition.